Well, a lot of you have been following along with my family's journey dealing with diagnosis of breast cancer. Last year, we raised over $8,000 for Real Men Wear Pink after we shared my wife's story, Megan, being diagnosed with breast cancer right before the pandemic shutdown started in full force, and she went through treatment without hesitation. And I think that is a crucial lesson to continue to talk about, and how you can't delay treatment, and early detection definitely saves lives. We're doing Real Men Wear Pink again, and I've got my nails painted pink. That's after I raised $1,300, and go to WMAY.com/pink. You can help me raise $4,000. I'm going to dye my hair pink. All right, so let's make that happen and get that $4,000 goal, blast through it to raise money for the American Cancer Society. And of course, a shout out to Heartland Hearing for helping us out. Heartland Hearing, better hearing starts today. Go to WMAY.com/pink and donate. But joining me is somebody who has a lot more information about what kinds of services are available to Sangamon County residents. Kaila Kirbach is a case manager with the Sangamon County Department of Public Health. She joins us now here in studio. Kaila, thanks for taking time with us. Tell us about the programs that Sangamon County has available.
Oh, you're very welcome, Greg. Glad to talk about it. Yes, I'm with the Illinois Breast and Cervical Cancer Program. We pay for screenings and diagnostics for women's breast health and cervical health. So that includes Pap tests, HPVs for the cervix, and also manual breast exam, and also mammograms. That's the screening part. But should they have an issue in either area, we then pay for diagnostics too, to help get a diagnosis or rule out anything.
Now, thankfully, my wife has awesome insurance.
Wonderful.
So we didn't have to necessarily worry about the cost. Of course, we had to pay out of pocket to a degree, but insurance picked up a lot of that.
Yes.
For those in Sangamon County that do get that devastating diagnosis of breast cancer, what's available through this program to help with offsetting some of that cost?
Yes. Well, let me just explain too, Greg. We're Sangamon County. We're also 9 other counties, and I won't take time to go through them.
Sure.
Give us a call out there. I'll tell you for sure if you're within our territory. But what we can do when someone gets diagnosed with, say, breast cancer, and they don't have insurance. All these ladies we're helping don't have insurance coverage for these screenings, diagnostics, and the treatment also. And we can fast track them for a medical card through the Health Care and Family Services to pay for all their treatment and follow-up in years to come. And it's just a wonderful benefit, so they don't have one bill, to pay for their treatment.
And this includes Sangamon, Menard, Logan, Macon, Morgan, Cass, Mason, DeWitt, Piatt, or is it Piatt?
Piatt, yeah.
Thank you. And Shelby as well. If people need more information about this, or if they're listening and they know a friend who's going through this, how can they get hooked up with this program?
They can certainly call our number, 217-535-3102. Ask for the Breast and Cervical Cancer Program. It will come to me or my partner, Deidre Berger. And we both help with this program, and we're so happy to do it. We love helping these women who don't have insurance coverage to cover these things.
We're talking with Kaila Kirbach with the Sangamon County Department of Public Health and the Illinois Breast and Cervical Cancer Program. It's not just for women. Men can get breast cancer as well.
Yes, we can bring men get them a medical card too, should they get breast cancer. Yes.
And these costs, it can be quite expensive. Not just the diagnostics, but if indeed that diagnosis comes through, you've got the various different types of options from surgery to chemotherapy and radiation, or a combination of different kinds with different timelines.
Yes.
All kinds of different types of breast cancer, either hormonally driven or not. But obviously, there's major expense there.
Oh, yes.
How much do you have, on average? What kind of burden is that for somebody who doesn't have insurance?
Oh, thousands to 10,000s with surgery and such. Yeah, lots of 10,000s.
Yeah.
I don't have a prediction,
Sure.
right here or an amount, but yes, very, very costly. Can put someone in debt for a long, long time and maybe never get out of it.
And this program that you're talking about here with us today can help those individuals with that burden.
Who do not have insurance to cover it, yes.
And again, give us the phone number for where people can get more information about this, because listen, not everybody listening is going to have to deal with this, but I think everybody listening knows somebody who is going to have to deal with this. And the costs can be exorbitant. And if people don't have insurance, there are options. And again, Kaila Kirbach here with us to tell us about those options.
Yes. Well, the phone number is 217-535-3102. Ask for the Breast and Cervical Cancer Program. We cover ages 21 to 64 for the breast health, but if a younger, and then 40, that's for cervical, and if and for the breast, it's 40 and up, when you're due for mammograms at 40 and up to 64 years of age. But we also cover young symptomatic women who might be below 40 age, and we can get them approved by the state once a provider diagnoses them with or at least, confirms they have an issue with their breast or cervix. We can then get them into the program.
Yeah, and I think this idea of early detection is so crucial. And sometimes people, they may feel something even on their own bodies that they're suspicious about, but then they don't want to move forward either out of fear of what the diagnosis could be or out of fear that this is going to bankrupt them.
Exactly. They may not have the money to go to a doctor to get it checked out. So they do need to call us if they notice anything different about their breasts.
And again, that phone number, 217-535-3102.
Correct.
217-535-3102. So crucially important that those of you hearing this message, jot that number down. Again, 217-535-3102. There are programs available to help offset the cost of the diagnosis and treatment for not just breast cancer, but also cervical cancer here in the state of Illinois, in particular in central Illinois, Sangamon, and some of the surrounding counties. Kaila, thank you so much for taking time with us. This is extremely important because I'll tell you, one thing I hear a lot of is the costs that people have to incur to treat breast cancer. It is treatable.
Yes.
It is treatable. And those costs, you can have some assistance with those costs through that program.
Yes. I want to just comment too, Greg, if they are not in one of those 10 counties you mentioned, they can still call me and I can hook them up with the correct program within Illinois that's in their area.
Again, 217-535-3102 is the Illinois Breast and Cervical Cancer Program. Give them a call at 217-535-3102. Kaila Kirbach, thank you so much for taking time with us this morning.
Thank you, Greg.
It is Springfield's Morning News. I'm Greg Bishop on 92.7 WMAY, Springfield's News and